Hi, I am going to guide you through the HS-400 Affidavit regarding patient money form. The HS-400 is a one-page form. This form is required on all new applications and whenever the department deems it is necessary to reevaluate the bonding need of a healthcare facility. In accordance with the California Health and Safety Code 1318, this form is intended to ensure that all licensed health facilities comply with statutory bonding requirements if they handle patient money. We is the name of the applicant, licensee, provider, entity, corporation, etc. Tip time: if you're a sole proprietor, you would enter your legal name. As applicant for is the name of the facility. Facility address is the number, street, city, state, zip code, and county of the facility. We certify that I check A or B below. A. If you will handle less than $25 per patient and less than $500 for all patients in any 1 month. Even though the form allows the applicant to indicate that they will not handle any money, pursuant to CFR Title 42, Section 483.10 C7, this is not an option if a SNF, CLIF, or ICF DDH or N wishes to be certified. You are required to obtain a bond for at least $1,000. B. If you will handle more than $25 per patient and more than $500 for all patients in any 1 month. If B is checked, please indicate the maximum amount of money that will be handled in the space with the $sign. Tip time: if the application is for a change of ownership, the amount handled must be the same or more than the amount of the audit and receipt of patient monies. Note: if B is checked, you will need to submit an HS-402 surety bond verification form. The table below this section will assist you in determining the required amount of the surety bond. Every additional increment of $1,000 or fraction thereof shall require an additional $1,000 on the bond. Tip time: if the money you are going to handle is outside of the table, your bond should be $1,000 more than the amount you are going to handle. For example, if you are going to handle $25,000, the required bond amount will be $26,000. Licensees are required to immediately notify the licensing agency in writing when the stated amount is exceeded, maintain adequate safeguards and accurate records of monies and valuables entrusted to the facility in accordance with the regulations of the State Department of Public Health. We certify that the foregoing statements are true to the best of our knowledge. Print the signer's name, title, date, and sign the form. Submit the form with an original signature. If you have any questions regarding how to fill out the HS-400 affidavit regarding patient money form, please call the CAB main line at 916-552-8632 or submit an email to cab@cdph.ca.gov. CAB staff will respond to your inquiry within 48 hours. Thank you for watching this tutorial. I hope it helps.